All right, we're gonna start from the beginning again.
Yes, we start.
Zhao Jian Jia. Thank you for having the interview to share your story. I have about 7 questions for you. So let's start with you telling us about your story, how you end up being a doctor, a Chinese medicine doctor. Tell us about your history.
First, we started this in Chinese Medicine University in Nanjing. 5 years. 5 years later, I graduate from university, then working hospital. That is we call is second class hospital in China. Roughly in that hospital is 400 colleagues work in this hospital. Over 200 inpatient bed, we call. Yes, I work in different department. Most stay longest is neurologist department. Yes. In here is work. In working hospital in China is quite intense.
Yes.
We treat the people is not just same here, Western medicine or Chinese medicine. We choose, our idea is choose what way is best for the patient. We choose that way. Because used to in China, we treat the patients is Western medicine and combine the Chinese medicine.
So you spend how many years in China?
17 years in hospital.
17 years working in a hospital in China before you actually decide to move to Europe. Can you tell us about the decision to move to Europe and what happened there?
Yes, from 2005, I got a chance to go to UK for work with different area, only Chinese medicine, because in here we low qualification with Western medicine. We only can got a qualification doing Chinese medicine. Used to is acupuncture, acupressure, and herbs. That is we work. From 2015, I go here meet friends. See here, surrounding is really good and more friendly. And my friends recommend me, you can work here. Then I just work here. First clinic in Mason, business school, 3 years. Then moved to here.
In 2018?
Nearly 4 years. Yes, nearly 4 years.
So you've been working since 2005. You spent 10 years in the UK treating people on acupuncture and acupressure, Chinese traditional medicine.
Yeah.
And then you moved to the Netherlands in 2015. You worked 3 years in Marston.
Yeah.
And in 2018, you decided to open a clinic right here in Utrecht.
First open in business school Marston. That is from here is from Marston moved to here. Just moved to here. Close there.
Right.
Then moved to here.
This is going to be something very deep. Like, can you tell us about what made you decide to pursue medicine as a profession? Like, how did you end up studying medicine in university and end up becoming who you are today?
Used to, I decided doing this. We say, it's not only for business we do that. Not only, it is business, but more focus we do. We happy is help the people sort out their suffer. That is.
How?
Another things, yes.
Yeah.
Another things, we doing this business. I'm not specialized the business. Just study for this. We say we just professional with the treatment. Sort of different type of problem. We happy with that.
Yeah, you are.
Enjoy with that.
Yeah.
That is from my heart.
Yeah, so you really enjoy treating people and helping them to recover.
They're feeling after suffering. They got my treatment. They're feeling much better. That's good
joy.
Gifts for me.
That's wonderful. Thank you so much. Given that you have spent 15 years in Europe, definitely you have some exposure to how people are treated in this country and this whole continent. So what is your thoughts about Western medicine and treatment? What are your thoughts about the way how Western medicine
Western medicine a bit different Chinese medicine, because Western medicine for some for some serious person, serious disease, they focus the short-term benefits. Another things that is Western medicine is used to is mostly is chemistry. Chinese medicine use natural way to help people healing. Most is similar. We say is arose your body recovering system to treat the disease. For some emergent problem, the Chinese medicine is we call shortless, is not advantage. Less Western medicine, but the chronic problem used to Chinese medicine is better than the Western medicine.
Can you give an example of?
For example, you had a heart attack, you should go to hospital. If you use Chinese medicine, that is, you passed the best time to treat it. Chinese medicine work on the body. It takes time, a bit longer, because if you had a serious problem, for example, you had some accident, you had some bleeding, you use Western medicine is better than Chinese medicine. If you use Chinese medicine, you can't stop bleeding. They had many because of too much bleeding, had too many problems with it.
That's very interesting. So, what are your thoughts on
for example, the Chinese medicine had some advantage. You had a sleeping problem. You take a sleeping pills, it works. But if you always take sleeping pills, it will addictive it. That is one thing. Another thing is you take a sleeping tablets. Next day you feel foggy, and feel tired. But use Chinese medicine, for example, doing acupuncture, is no this side effect and work better than the sleeping tablets as well.
Can you list down the top problems, the top disease or
for
issues
example,
that people here in this country or that normally comes to you and actually it helps them a lot? So you said sleeping problems is one of them. Can you name them? Can you list them down?
The mental, we say mental problem. Mental problem.
Mental problems.
Yeah, stress, anxious, depressed, and some even we say is mad. All this mental problem, we do Chinese medicine. We treat many. That is quite, especially in this time, the COVID, especially in this time, in COVID, many people, they have a mental disease. Use Chinese medicine is really good. Most, they are quite good result.
Wow, thanks for sharing that example. What are your thoughts on the future of medicine? So combining Western and Asian medicine together. What are your thoughts about that?
Used to they come here. Most they had a Western medicine. They had a diagnosis is quite clear diagnosis, but just no treatment is not properly. Many patients, they had a problem, they try many things, but finally they find ours. They're try to our treatment. They got a result is they had a good result with our treatment. That is why they coming here and recommend their friends or family member come here.
Don't you think that it's a shame that they have to try out they always prioritize
some
Western
people,
medicine first and then wasted a
most
lot of energy,
a lot
of energy and effort only to realize that Chinese medicine will for them. So don't you think that it is important for doctors nowadays to be trained, to be aware about Chinese medicine, so then when they diagnose the patient, they can already know, all right, you have this problem, and it looks like the majority of people are healing from Chinese medicine. So just don't waste time on here. Just go directly to the Chinese medicine instead.
Not only, I think we recommend if the local doctor for example their GP, they know about what is Chinese medicine. You not reject, just say Chinese medicine is no use. I heard about many patients. That is why we don't say Chinese medicine is quite effective. You can try. You feeling for yourself. Use that way. We going where? That is, we just recommend if the Western medicine, Western doctor, they should know about Chinese medicine. It's not just thinking or prejudged. That is not good.
I guess that's a very good message to your colleagues in the Western medicine world. To be open.
Yes, to be
not
open.
To make assumptions. That's why you're
in here. Yes, in here, I had a few Western doctors. They come here for treatment. for example, had neck pain or lower back pain or some digest system problem. For example, we call IBS is used to, they come here, they get a good result. They believe it.
Very wonderful.
Yes.
Last question. What will be your message to the Dutch public out here who have all sorts of problems, but they are not able to be treated? By the current solutions?
I think
offered,
right now,
what would you say to them?
we won't say just because the public is for us is most people, they are believe because they are effective. But some people, I think because of culture, they don't believe us. Third things, I think, because that is Dutch national health system is a bit different. The payment or recovered, the we call insurance recovered is a little bit different with our Chinese medicine. Because the Chinese medicine, it is belong to the health insurance is alternative treatment. In China, the Chinese medicine, every hospital they had this department, all is for national health system. In here is just different, we say. That is.
That's all the questions I have.
Yes.
Do you have any questions for me?
No. Thank you. Yes.
Thank you so much for sharing your story.
Yeah.